Okay, so this is the manual muscle test for the internal abdominis obliques. So again, like before with the rectus abdominis, you want to be very careful if the patient comes in with low back pain, because just getting into the position to do the test, which I'll show you in a moment, can be uncomfortable. So if there's a lot of pain or discomfort, even at the beginning of the test, then you just want to stop and just, we can show you how to test this muscle with simple palpation over the area of gallbladder 26, which is the motor point for the internal abdominis oblique. And we can also show you the motor point, which is liver 13 of the external abdominal oblique. Right, so this is what allows us to do perform spinal flexion as well as lateral flexion, right, and ipsilateral rotation. So this is what we'll be testing for the internal abdominis oblique. So like with the rectus abdominis, you have the patient sit up, cross their arms, right? Make sure their back is straight. Again, they can put their chin wherever is comfortable. I like to have it generally straight. That takes a little bit of pressure off the low back. But again, if people have something going on with the low back, especially involving the spine, tucking the chin, raising the head up a little bit might be a little bit easier for them. All right, so unlike the rectus abdominis, to test the right internal oblique, we'll have them twist to the right and then get into about 60 to 75 degrees, okay? And then similar as before, I'm gonna be stabilizing their legs and then pushing them down and a little bit twisting, right? And resist, and resist, and resist. Okay, and relax, okay? And then we'll test the left side. Okay, so go ahead and cross your arms again. And then this time you're gonna turn towards me, very good, okay? And then I'm gonna press down. So I'm gonna be pressing down and a little bit to her left. And I'm stabilizing the legs. And resist, and resist, and resist. Okay, let's have you tilt just a little more. There we go. Okay, and one more time, and resist, and resist, and resist. All right, very good, and relax. So she has very strong internal abdominis obliques, which is great. That actually will, when working on these muscles, the internal and external obliques, which we'll test in a moment, this is what helps a lot of back pain prevention as we get older. So if we can get people to start working on their core muscles, when they're in their 20s and 30s and 40s, that makes the 50s and 60s and 70s much more comfortable. Very good, thank you. All right.